If I could get to a veterinarian or I could get to help, I would probably immediately proceed to the veterinarian's office. If I'm on the Middle Fork or out on a float trip, I'm out in the middle of nowhere, I would administer prednisone, antibiotics, and antihistamine. I would keep that body part elevated. Usually it's the face. I'd keep it up in the air to delay absorption. I'd passively ice it, and I'd work that way. The wound is usually going to swell tremendously. It's going to turn dark in the center, and the skin's going to fall out. Antivenom is occasionally at different veterinary clinics. It's fairly expensive. It goes bad fairly quick. I think it's $270 for a vial of it. If we get one in that's really severe, we have them on IV fluids. It looks really bad, we go ahead and give them the antivenom. The antivenom has to be given IV, and it has to be given in a catheter. I don't think you're going to be carrying antivenom with you in your backpack. It also has to be refrigerated. So antivenom isn't some quickie little pill you give them and everything's okay. The hope is that you won't run into snakes. If you do, maybe get some advice from your veterinarian, maybe get some different opinions about it. Seek professional help as soon as you can. In general, poisonings are going to be rat bait, those little decon boxes, possibly drinking antifreeze out of a winterized cabin. Sometimes strychnine or 1080, you actually see them eat a bait. Most caustics, i.e. battery acid, lime, lye, dogs really won't eat. Caustics, of course, you don't want to have them vomit it up because they burn their esophagus twice. But again, most poisonings, the principle is get it out as soon as they eat it. Don't call the vet, don't do anything, or make means to get that poison out of their system before it gets absorbed, before it gets way down into their GI tract where you can't get it out. The best vomit is when the green decon comes up and there's a bunch of dog food behind it. That means it all came out. The dog had eaten and he got all the decon out. With that poisoning, you may not even need to seek an antidote. If you think your dog still has poison inside, you need to know the type of poison they ate, the weight of the dog, the amount of time that's gone by since they ate the poison, and you need to call that poison control hotline that's in your first aid book. You also should call your veterinarian and seek the proper antidote for whatever poison they've taken. Laryngeal paralysis is a common disease in older large breed dogs. You'll know it's coming because you'll start to hear your dog's voice change. There'll be some gagging when we're eating or drinking. And when we're hiking, we'll start to... We're making more noise through the voice box than we used to. What's happening is these are the laryngeal cartilages in here. They're supposed to be opened up by a muscle called the cricoretinoideus with each inspiration. So we go... Well, you can imagine if the door opener broke, this is going to go... And the air's not going to fit through there too well. And we also start to slop some food into the trachea or the windpipe, and that causes occasional gagging. With this disease, you're on a hike, your dog's slowing down, he may be turning blue, and he's really not breathing too well. You seek shade, you get him cooled off, you walk slowly back to the car. You go to a certified or qualified surgeon, and they'll probably perform an operation called a laryngeal tieback. Basically what happens, your veterinarian will get you lined up with someone to tie this door open, so on inspiration, the air can come in and we won't have this rattling. Again, seek shade, calm your dog, walk slowly back to the car, and seek your veterinarian's opinion about the possibility of a laryngeal tieback surgery. Porcupine quills are fairly common in the Rocky Mountain West. We see a lot of cases. Seems like they come January and February every year. Sort of the porcupines are coming out. At any time you're on the trail, your dog goes over there, he's naturally curious. Normally they'll get hit in the nose. The dog comes yiking out of the bushes with about 10 of them in his nose. This is an issue you could deal with right there on the trail. Hold the dog down, pull straight out, and just get those 8 or 10 quills out of his nose. There's a picture here of a little more serious case. If your dog's completely coated, his mouth is full of them, he actually bit the porcupine. Don't try to fight your dog with this one. You're not going to get them out. You're going to end up breaking them all off. You're going to get bit. Your dog's going to get further hurt. This is not an extreme emergency. These can go for a day or two. If you need to backpack out the next day, it's fine. Your dog's okay with these porcupine quills. If there's quills in the main body of the dog, keep in mind if you lift up one quill, there's a bunch of quills beside it that will get underneath the skin. So when you're pulling quills, hold down with your fingers and lift with the hemostat so that you're holding the skin of the body so you don't lift the skin away and the quills around it get pulled completely under. Quills are not an extreme emergency. Oftentimes you can take out 10 or 15 yourself. If your dog has a whole mouthful, just realize that it can wait 12 to 24 hours and take your veterinarian. At the veterinarians, they'll have a general anesthetic and they'll be taken out and not broken out under the skin. Mosquitoes can be a problem for your dog just the same as they are for yourself. At a high mountain lake, sometimes the mosquitoes will just coat the dog. You'll have your own mosquito spray handy. Go ahead and use it on the dog. Cover their eyes, apply it liberally, and most humans' mosquito sprays are fine for dogs. Another problem we encounter is tick infestation. There's a lot of products that you put on the middle of their back that repel ticks. If you're going to be in a real tick infested area, I'd recommend using one of these products. Tate loves his backpack. He likes to put it on. He likes what it means. He knows we're going somewhere. For those of you that backpack with your dog, you want to keep a few things in mind. Whatever you put in the backpack is very likely going to get wet. So put the dog food in a plastic bag. If your dog's a little older and arthritic, let him carry the light stuff. Make him carry the trash out and possibly something waterproof in. Fitting of the backpacks is important. The dogs are real subject to rub sores on different spots. You want to make sure it fits well. You want to make sure it's not too heavy. When your dog's in a creek or a river with the backpack on, he's got a lethal weapon on his back. This will hang him up on trees, etc. So be careful of that. You might want to take some sheepskin padding and pad certain spots of the backpack to make them more comfortable. But dogs love their backpacks, and I think it's great to have them carry some of their own stuff. Just make sure it fits well and make sure you're responsible for their health in certain situations if it gets hung up on something. Now you have the knowledge and the equipment to take care of your dog's injuries. Keep in mind there's one major thing that needs to be taken care of with each injury. If they're bleeding, stop the bleeding. If they have quills, get the quills out. Remember, you can influence the outcome of your dog's injury. Think, relax, use some common sense, and you'll have many happy trails.